Welcome, everyone. I'll just give a few seconds for people to join. So good morning, good afternoon, good evening to everyone, especially those of you who are joining from far away where it's late at night or early in the morning. Thank you for joining today's EPIWIN. For those of you who are new to EPIWIN, and of course, many of you are familiar, it stands for WHO Information Network for Epidemics, and the goal is to share knowledge for evidence-informed actions and policies. So today we have an exciting topic and a very exciting list of speakers to tell you about it. It's about transforming IPC practice. That's infection prevention and control practice. So new tools and implementation approaches for outbreak preparedness and response. I'm Supriya Besbara. I lead on EPIWIN for WHO. We have the welcome remarks today. We are privileged to have Dr. Abdi Rahman Mahmood, who's the Director for Health Emergency Alert and Response Operations at WHO. After that, you'll hear from Dr. Maria Clara Adoveze, Senior Associate Professor, the School of Nursing in University of Sao Paulo, who's also for a former WHO consultant who did the literature review, organized all the coordination for this manual. She'll give you the overview of the framework and toolkit. Then you'll hear from Ana Paula Coutinho, who's from the Regional Office for Europe. She'll give you the regional perspective of how this IPC outbreak implementation manual can be used. Then from the field, we're privileged to have Dr. Artem Hobashevsky from Ukraine. In spite of a very busy schedule, he's agreed to join and share their experiences. So really very grateful for that. And then from Resolve to Save Lives, a well-known international INGO, you'll hear from Dr. Amy Elizabeth Barrera on how the IPC framework can be used in a primary healthcare setting. Of course, we love to hear from you. So please put all your questions, as always, in the Q&A box. And we have Dr. April Balla and Dr. Emilio Hornsey from the UK Public Health PHSRST moderating your questions. So I hope here you'll find it really interesting and valuable for your work. With that, I'd like to welcome Dr. Abdi Rahman Mahmood for the welcome remarks. Over to you, Abdi.
Thank you so much, Supriya. Good afternoon, good morning, and good evening, colleagues. It's a privilege to welcome you all, policy leaders, healthcare professionals, emergency responders, and IPC champions, to this important knowledge sharing session. Your presence today, and the number is increasing, I'm looking at almost 700 people, reflect a shared commitment to protect life, strengthen our health system, and ensure that communities can face public health emergency with confidence and resilience. Over the past decade, from the West Africa Ebola outbreak to the COVID-19 pandemic, we have repeatedly witnessed how rapidly outbreak can escalate and how weak IPC system can lead to amplification within health facilities. The WHO 2024 Global IPC report reinforces this reality. Preventable infection continue to harm patients, overwhelm systems, and place health workers at unnecessary risk. But it also tells something else. When IPC is strong, lives are saved. Outbreaks are contained, health systems stand firm. And that's why we gather today. Today, we turned IPC Outbreak Framework and Toolkit Implementation Manual, a practical evidence-based tool designed not only to guide technical action, but to empower countries to build a better IPC system that's proactive, coordinated, and ready to respond when it matters most. Across countries and regions, health leaders and frontline teams know what needs to be done during outbreaks. They have the knowledge, they have the will, and they have the experience. But often what's missing is how. The operational clarity that turns commitment into action and action into impact. The IPC OFT implementation manual fills this gap. It translates evidence into practical steps. It provides the tools to be adapted to different realities. And it strengthens the foundation that every country needs before the next outbreaks arrive, not after. This approach echoes the global strategy on IPC endorsed by the World Health Assembly that every country should have a functional IPC program integrated seamlessly into the emergency preparedness and response. It also supports the core capacity required under IHR, underscoring IPC as a pillar of national health security and global solidarity. The IPC framework provides a clear, powerful structure for actions across all levels of the health system, from preparedness to readiness and to response. These three phases are complemented by 10 key IPC actions that countries can take at the national and facility levels. Our aim today is to introduce the IPC OFT implementation manual, gather regional perspective from our Euro colleagues, share practical experience from country. Thanks for Ukraine joining us today, and explore how IPC integrated with broader health system, and more importantly, at the IPC level. We hope these sessions becomes a platform for learning, reflection, and actionable insight. As countries continue to confront both ongoing and emerging health threats, often while navigating significant financial constraints and diversion of resources from health system to defense, your leadership and expertise have never been more essential. I encourage each of you, whether you shape national strategy or work on the front line, to download this IPC OFT implementation manual, make it your own, and put it into action. Because when IPC is strong, patients are safer, health workers are protected, even in the most challenging emergencies. It's now my pleasure to invite our first speaker, Maria Calara. Over to you, Maria.
Okay. Thank you very much for the invitation to participate in this webinar, which has the objective to present the implementation manual for framework and toolkit for IPC, outbreak preparedness, readiness, response, that was recently published, and share country experiences. So can you please show my slide? Yeah, okay. So many experts contributed to the development of this implementation manual. Their names are acknowledged in the document. And on behalf of the IPC and WASH team in the World Health Emergency Program, I would like to thank all these experts for their contribution. The next slide, please. Why this document is important? So this image in the slide represents the overview of outbreak amplification concept. Infections occurring during outbreaks can spread within healthcare facilities, resulting in healthcare-associated infections. This leads to a pathway of amplification of infections to multiple communities, eventually spreading across border to the other countries. And the large recent outbreaks such as COVID and Ebola have exposed the gaps in infection prevention and control, IPC as we used to say, programs that exist in all countries. So next slide, please. So therefore, strengthening IPC preparedness and operational readiness are pivotal for effective outbreak response. To achieve better results, it is essential that policymakers and healthcare workers turn lessons learned from every outbreak into actions, aiming to improve the response capacity. That consider this implementation manual provides resources for health authorities to support the implementation process. Next. When do we need to act? The previous published IPC outbreak framework has the key concept of time in relation to the threats in public health emergencies. So during the preparedness phase, can you click next, please? We should build the basics, mapping risks and planning the actions. During the readiness, it is time to adapt all the plans to disease-specific focus. And during the response itself, we will activate and in this framework, the priorities of actions within each phase are organized as immediate, early, and advanced. And as I mentioned before, these phases represent a continuous cycle that includes a feedback element. Next, please. So, and what we needed to do in all these phases, the outbreak framework have key IPC actions that are indicated to be implemented at both national and facility levels. As you can see here, these key actions include a systematic approach for evaluation of IPC capacity, preparedness and readiness response plan, guidelines development, surveillance and reporting program, communication strategy, surge capacity, outbreak task force, partners and network mapping, and the assessment of the system should be implemented. Next. So we know what to do and how to do it. Then we came with the objective of this implementation manual, which is to provide national and subnational authorities with step-by-step directions and tools for implementation. So you have to combine the use of these documents. So you can see here the framework for national and health facilities. And you combine what to do and how to do. At the right side of this slide, you can see a very quick summary of the content of the implementation manual, which I will detail in the next slides. Next, please. So this slide gives an overview of the structure of the implementation manual. First, identify the emergency phase, then select the key actions according to the priorities, then follow the steps and how to perform it, and search for the corresponding tools as needed. Let's see in more detail next slides. So, sometimes there might be difficulties to identify which a given public health emergency phase we are. So keep in mind this is an event-related conditions. And for instance, one country can be in a preparedness phase for one disease, for example, Ebola, and in a readiness phase to another disease, for example, measles. In this implementation manual, you can find a logical algorithm to facilitate this identification. By answering these two questions with a list of situations, as you can see in the slide, it is possible to easily define the phase and go to the corresponding chapter in the manual. Next. Then, following this emergence phase identification, we are going from key actions to tools and multiple steps. For each key action, the user of the manual should follow the steps and how to do it. In the first column, you see in the slide, we show the key actions. Second and third column, you have the detailed steps. And the last column have the information about the suggested tool and resources to support and facilitate the implementation of that key action. And this structure goes in the same way along the manual chapters for preparedness, readiness, and response. And so you have a color code to facilitate your comprehension. But note that for the preparedness phase, many activities and tools are related to basics in the IPC programs and refers to well-known tools such as IPCAT, WatchFit, and others. Next, please. So one chapter of this implementation manual brings inspirational practical examples from countries. These countries' examples were collected from interviews with relevant stakeholders in some countries to present actual situations of barriers and strategies they adopted to overcome them. Here in the slide, you can see one example of simulations and exercises that occurred in Singapore. And also for case studies, there are some examples that we collected during the literature review that illustrated the key actions and steps for the implementation. Next slide, please. And during the development of this material, we performed several interviews and focus groups with participants from various countries. This resulted in a list of potential barriers that can be anticipated in a given context. As examples, the lack of IPC awareness and lack of coordination are frequent barriers. For them, there are suggestions of strategy how to overcome them. For example, the partner mappings and stakeholder analysis, contingency plan development, among others. Next slide, please. And finally, this implementation manual has a wide range of tools. We developed around 20 tools, which include assessment tools, templates, checklists, and prototypes. These tools can be downloaded and filled in or adapted. You go to the list, click on the title, and download it. So additionally, we have a detailed list of resources updated in the manual, and this providing according to the resources, you have the list according to the type. Next slide. So in the next slide, you have some of examples of the tools that we developed. Many of tools developed for the purpose of this implementation manual were based on feedback and learning from previous outbreaks. For example, we know that many countries, they wanted to quickly establish their task force but they lack examples of terms of reference. So it's possible to download one example of terms of reference and adapt it. As other examples, there are templates for standard operational procedures for IPC, prototypes for programs of training of trainers, Excel spreadsheet for action plans, partners mapping, stakeholder mapping and analysis, and also there are prototypes for contingency plans and a simulation booklet specific for IPC. The Hero Cape is part of this package of tools, which you may be aware because there was months ago a specific webinar about the Hero Cape. So there are many tools that you can use it. Next slide, please. So in conclusion, the IPC framework toolkit and this now implementation manual will help countries build stronger preparedness, readiness, and response capacities at both national and subnational levels. The tools provided in implementation manual are adaptable and can be tailored to each country context, priorities, and health system needs. Together, these resources support sustained improvement in IPC. We aim to save lives, as just said, helping prevent outbreak amplification and strengthening national health security. With the next slide, I would like to thank you, and I will be available for questions in the Q&A sessions.
Thank you so much, Maria Clara, for that overview, and thank you for all the amazing work you've done, along with Dr. April Boller and the whole team for this. Now, before we go on to the regional perspective, we have a very important tradition of EPIWIN. It's to hear from the participants. So, as usual, we have a Slido. Can you see my screen? So, sorry. I'm going to stop sharing for a minute, and I will, because I seem to have a problem with the question, and then reshare again. So slido.com, hashtag 2990529. What are the first words that come to your mind? What do you think is important about IPC, which is infection prevention and control? Okay, so we get hand hygiene and education as the top ones, then communication, protection, safety. But I'd love to see more responses. According to my Zoom, there's more than 800 of you out there, 884 and counting, and we see less than 100 responses. So we get a variety of PPE, prevention, protecting patients, situational awareness, but hand hygiene and education seems to be top, according to you. That's the most important. Great. So as usual, my Slido will be on, so continue to share, please. This is very useful for us, but in the interest of time, I will stop sharing my screen here. And I now request Dr. Anna Paula to present the regional overview. She is the IPC focal point for the WHO Regional Office for Europe. So over to you, Anna Paula. Why is this important at the regional level?
Thank you very much, Supriya, and good afternoon, colleagues. I'm very excited to see so many colleagues from the European region. So my big hello from very, very cold Copenhagen. Wonderful that you all managed to join, and all other colleagues from the other regions. So it's amazing. So I just want to say a few words about the European region. The European region, the WHO European region, has 53 member states and 2 state parties. This region is the region of diversity. We have, countries that have several financial challenges, but we also have countries that are very wealthy, right? The richest and the poor. We have part of the population that have access to universal health coverage, and part of the population doesn't have access, has to pay, right? So this region, it's very diverse. So if we move to the next slide, please. It feels like it was a long time ago that we saw these images, right? When our Director General declared the pandemic, right, the COVID-19 pandemic, before declaring, no, this was after declaring that it was a public health emergency of international concern. And we, at that moment in time, we, infection prevention and control professionals all over the world, regardless the level of development, we found ourselves in the most challenging times of our profession. We have to deal with amount of work, with a diversity of work that we were never trained for. And we need to ensure quality, safety, and make sure that patients are treated according to norms and standards. Then we have others, other events, right? As an example, the mpox emergency. And what I see, can you please move to the next slide, is when we talk about the implementation of infection prevention and control as a core capacity under the international health regulations, as mentioned by Dr. Abdi. So we still see a lot of color, right, in this slide. You already, I think most of you know, I'm Brazilian, so I love to see green and yellow because it represents my country. But I really would like to see this dark green getting bigger and bigger and bigger. If you notice, there is a big change between 23 and 2024. We have more countries that are in a lower score than the year before. Does it mean that we are, going back in time? No. What means is that we are now assessing our capacities to make sure that we progress and implement things. Next slide, please. With the launching of this very important, very useful, and very practical implementation manual, which I'm delighted with the publication. This will help us, infection prevention and control professionals, at national level, at the facility level, to understand the language, preparedness, readiness, and response, to be part of this movement. Because after so many big events like emergencies, outbreaks, we, infection prevention control professionals, we cannot afford not being part of the systematic response. And with that, I would like to, next slide, to invite colleagues from the European region, right? If there are participants attending the webinar today, if you have interest to implement this framework or to implement the implementation manual, reach out to me. It will be my pleasure to work with you. Thank you very much. I don't know if I'm the one who's supposed to introduce you, Artem.
Thank you. Sorry, Ana Paula.
No problem.
Thank you very much for that overview, and also thank you for keeping to time. Appreciate that. And from there, we now request the perspective from Ukraine. So over to you, Artem.
Yeah, thanks a lot, colleagues. Nice to meet you all. Thanks for coming for this webinar. I'm really too happy to participate and try to show you what goals we achieved while we was testing this tool. So my name is Artem Horbachevsky. I'm head of antimicrobial resistance department and also infection prevention control in Public Health Center under Ministry of Health of Ukraine. Please, next slide. As previously my colleagues already introduced this tool, I will be really practically and I will try you to tell more practical things. So in Ukraine, we decided to test this IPC tool with a structured and collaborative mission approach. Next, please. We have chosen two currently relevant outbreak threats with different transmission pathways and response requirements. Next. Yeah, and it was measles and cholera. Next, please. Yeah, you can see priorities of IPC measures for this disease, and as you know, Ukraine is pretty difficult situation with healthcare system, and we should be ready for any situation, anytime. So piloting this tool is really helpful to test how in practical approaches we can respond for different situation. Next slide. In 2024, as a step of preparation, we have visited with our colleagues from WHO several institutions in Ukraine. So as you see, it was a primary healthcare facility, next emergency medical service station, regional center of disease of control. Also, we visited secondary healthcare facility and next, and tertiary healthcare facility, and it's really helped us to understand what is going on the ground on different at different type of facilities in Ukraine, because we frankly have quite a big number of facilities with different type of healthcare, and to make the picture more clear for us, that was really useful thing. Next one. What main our key insights was during testing this tool on practical things in context of our Ukrainian situation. So for cholera, we found out that we have outdated guideline cholera, and it was confusion about PPE use. After this examination, we looking forward to update national cholera guidelines, and additionally, we are going to provide hero cap assessments. We decided to provide it on two levels, like national level and for each regional, because in Ukraine we have 25 regions and they really different, and their own place really different situation and in this context we can understand better which measures will be more useful for each region. As for measles, we have participated in several outbreaks with measles, and we found out that we have really communication gap between primary healthcare facilities and regional CDC. And it do not let us to have information in time as fast as we can. But from what we saw also from these outbreaks last year, we need to it's highlighted us, if I can say that way, existing gaps, and as a result we provide new tool for assessment for healthcare facilities with help from our colleagues from WHO, and we are going to assess these facilities in even I think next week we will start this work. We are really spend a lot of time for preparedness, but now we are moving on. So the main insight maybe that I should highlight that in Ukraine, outbreak preparedness is multi-institutional and complex outbreak preparedness. It should consist of response for multiple sectors as healthcare facilities, emergency service, police, etc., etc. Aligning one unified algorithm across all these sectors will be really helpful and can make things more easier. Unfortunately, IPC receives limited attention at all stages, even throughout this crucial situation and spreading disease inside Ukraine, and also the situation with resistant pathogens. Also, you can read on slide. I won't stop here about undervaluation of IPC. In main thing that we have like minimal requirements that is mandatory in Ukraine from 2024, but still exist issues for their implementing. Yeah, next slide, please. Yes, maybe that's all that I wanted to show you. Next. And next, please. And really, from my heart, very big thanks for WHO team for really supports us on place and online each 2 weeks, anytime. Yeah, it's really very helpful to be in clear mind and to do our work properly. Thanks a lot for attention. That's all from my side.
Thank you so much, Dr. Arten Chobachevsky. As you can see from the emojis coming up on the thing, your presentation the country presentation, country's experience really seems to have struck a chord with most of our participants here. So thank you very much. Thank you for making the time as well. I know as head of the Public Health Center, you know, that you're very busy, so really appreciate it. Um, and there are also a few questions for you in the Q&A. But with that, I would now like to shift from the country level to the primary healthcare perspective. So with that, I would like to invite Dr. Amy Elizabeth Barrera from Resolve to Save Lives to talk about IPC and outbreaks in the primary healthcare setting.
Thank you so much. Wow, it's really difficult to follow Artem. So I'm going to do my best, but it's an impossible job. So I'll do what I can, but it's really hard being the final presentation, particularly after Artem. But thank you so much, everyone, for joining today. I'm going to talk a little bit about sort of how these tools can be used at the primary healthcare level. Now, I know initially these tools were developed having more of a focus at the national and subnational level. But what I've learned throughout my experience over the last couple of years engaging in a pilot project at the primary healthcare level that I'll talk a little bit more about, their applicability really does expand beyond just these two higher levels of our health system. Next slide. So I don't have to go and belabor too much on these points, but why focus on IPC readiness, preparedness, and response at that primary healthcare level? And so just to highlight what we all know is that we're having an increasing number of health emergencies, as my colleagues have previously highlighted. Primary healthcare really serves as the entry point, if you will, into healthcare systems. And it's really important that as they act as this first line of entry into the healthcare system, we're also doing our due diligence to ensure that while we're responding to an outbreak or an emergency, we're doing our due diligence and trying to maintain healthcare services, supporting countermeasures, and definitely engaging and working with and alongside our communities. And I'll speak a little bit about that as well. Unfortunately, the reality that we've all highlighted is that primary health care remains underfunded, understaffed, and oftentimes overlooked in terms of response planning. And we're all too familiar that IPC suffers that same fate as well when implemented at the PHC level. So is there a way to really elevate the critical importance of both of these two things, IPC and primary healthcare, to make sure that we're better prepared to respond to outbreaks? And this was the question that colleagues and I started to really ask ourselves 2 years ago when we decided that we wanted to engage in a pilot project called Epidemic Ready Primary Healthcare. Next slide. So what exactly is epidemic ready primary healthcare? Well, it's an approach that really strengthens primary healthcare from the protection, the detection, and the response side to outbreaks while ensuring there's a continuity of essential services. In 2023, we started a pilot project in 4 different countries and in about 800 primary healthcare facilities, where we were specifically focusing on infection control, surveillance, connecting with communities, and then making sure that treatment was also a part of this. By de-siloing these technical areas, what we did is we came together and created a suite of activities and interventions that I've highlighted on my screen here to really focus on strengthening all of these technical areas, with a strong emphasis on infection prevention and control for the reasons that I listed previously. Next slide. And doing so, one of the things that we were constantly thinking about is how do we really prepare primary health cares for outbreaks? So we really started to utilize the framework and the toolkit that was initially available and really start referencing the timelines, the essential activities within those documents, and started to try to do a mapping exercise to see what was some of the applicability of that content to the health facility level. Now, I'm going to be the first to admit that 2 years ago when we started this, I wish I wish we would have had this implementation manual, particularly with all of these tools, because 2 years ago, as we were using the framework and the toolkit, we were having to, in real time, use the tools that we currently had available to us. So just like the implementation manual says, for preparedness, the first step in activity is to evaluate IPC capacity. So we started thinking about, in terms of primary healthcare, what tools do we currently have available to really assess capacity at the PHC level? In reviewing those tools and developing some of our own questions, we created a mentorship tool which really assessed the functional capacity of IPC. So performance specifically around IPC. And we added in questions like you see the example here on my screen. Can an isolation and holding area be rapidly established the minute healthcare workers at the primary healthcare level fear they have a priority pathogen at their doorway? What I've come to learn 2 years later is that if we would have had this implementation toolkit, a lot of this would have been all in one package, and we wouldn't have had to go through sort of some of that painstaking work that we went through a couple of years ago of trying to really cater some of this to that PHC level. But in doing so, the implementation manual sets out very nicely the steps that one would want to also think about IPC implementation for preparedness at this lower level of the healthcare system. Next slide. So just as I highlighted sort of the first step, I just highlighted a few steps here as well that we really considered when we were going through this process. And so the second step here, just to give you a small sampling, was we developed primary healthcare preparedness and response plans. And in so doing, we focused on specific actions with accountable parties that were pre-identified in advance, right? Making sure that we had, responsibility and accountability matrices. And a lot of the tools that are in this package are very much adaptable and very much applicable. And so looking at that, identifying a holding area in advance, it's some of these built environment and infrastructural issues where we're very limited at the primary healthcare level. But doing this planning and being able to help healthcare system teams, as well as those at the next level up at the district level, be able to pre-identify some of these rapid changes that we would need to have ready to go in the event that we have a priority pathogen present at our doorway. Next slide. And then just the last small example here. This is just a small sampling of a lot of the activities that we undertook during this pilot, but just to show how did we ready primary healthcare facilities during outbreaks. Well, similar to the content that's mentioned in the implementation manual, we made sure that we prepared our IPC stakeholder networks, really developing and implementing communication plans, particularly at the community level, so bridging the community, the primary healthcare level, and then the next higher level at the district or subnational levels to make sure that there was that continuity and dissemination of information. And of course, we also engaged in real-time mystery patient simulation exercises to really make sure that all of the things that we had put in place around the built environment, so to speak, at the primary healthcare level was actually able to be functionally operationalized in the event of an emergency. Next slide. And so what did we learn from this? Well, as you can see here, from baseline to inline, we saw huge gains in terms of primary healthcare facilities being able to functionally operationalize a lot of the actual activities that are mentioned in the implementation manual. You can see that there was huge gains in overall epidemic-ready primary healthcare scores, which was an average score of IPC, surveillance, and preparedness metrics. And then we learned that there was also significance in a lot of the countries across a lot of these different domains. So we really felt like the innovation was in the integration of sort of integrating all of these technical areas. But what we really saw was when we made gains in infection prevention and control, those facilities that had larger gains in IPC overall were a lot more functionally ready for a priority pathogen entering into their doorway. Next slide. And then I'll just end here with a very quick practical example. As you can see, We had large IPC gains, which ultimately lended itself to stronger IPC practices and safer healthcare workers. So one of the things that we're very proud about is that we were able to not only increase knowledge, but increase practice within these facilities, minimizing that no-do gap that we're all too familiar with. And then, of course, making sure that we were able to have PPE and emergency supplies ready and available was improved within 80% of the facilities, maintaining emergency stock. So thank you so very much. Next slide. That's my last slide. And my overall encompassing message here today is that really these tools and resources are just as relevant at this facility level. And I'm happy to talk to anyone who might want to think about utilizing them within their contexts in the future. Thank you so much. And then my last slide is just saying I really appreciate the opportunity to be with you today. Thank you.
Thank you so much, Amy. Wow, those the figures were really impressive. Great to know how it can make a difference at the health facility level. So, as you know, look at those applause and hearts coming up there. So fantastic. So I'm sure all the participants have a lot of questions with these excellent presentations on how they can be implemented at their level. So I now hand the floor to Dr. April Buller, who's the team lead for IPC at WHO and really has been spearheading this area, with Emilio Hornsey for the Q&A session. Over to you.
Thank you so much, Supriya, and it's a pleasure to be here today and really interesting presentations. So congratulations to everyone, and thanks also for all the participants for joining. And we have some great questions here, so it's good we have a little bit of time. So we're going to start with the questions, the Q&A session. And if anyone has things they would like to ask that they haven't already, please do put them in, and hopefully we'll be able to get through a few of them. So I'm going to start with the first one here. I'm going to read it out, and I'm going to ask Anna Paula from a regional perspective really to respond to this one. So it's a very good question to ask, what type of approach would be better when we plan IPC? An all-for-one approach or to prepare for a specific disease? So a very good question. Over to you, Anna Paula.
Thank you very much. As April said, this is a really...
Oh, Anna Paula, we're not hearing you well. Try once again.
Can you hear me now?
Yes, perfect.
Okay, I was
Yeah.
still muted. Thank you. That's a very good question. So I think just just to put here a bit, try to contextualize. Diseases, it's not that they have a calendar and they agree, this year I take Christmas and you take Easter or, summer break. That's unfortunately something that we cannot expect from pathogens. They are, they of course, they are pathogens that there is a seasonality, right? But they're pathogens that, happens all the time throughout the year. So that is the first thing to consider. But I think what is most important when you are looking at the preparedness phase is really to identify where are your major gaps and be honest and look at these limitations as an opportunity for the transformation, right? Because that is the key aspect. We had a wonderful, I'm suspect because I have a great collaboration with my with Dr. Artem and his team in the UPHC, Ukrainian Public Health Center. I am privileged that I have a team that we discuss these things together to say whether it's important, because we decide on, as he's explained, we use measles and cholera. And this, if we look at, is this a seasonality? That was not the only reason to look at this. So you can start, and as more generic, there is a tool that is called, I think it's IPC contingency plan, is the list E that helps to, give an idea. If you want to start with disease X could be the next disease, or could be, a generic group that you think, okay, if we're talking about that are diseases that are transmitted through through contaminated water, for instance. So you can, pack it, but I think try to diversify by pathogen. This has been what we have been doing for so many years. And then we get entangled with the details. And we have to look at the major aspects, the core elements of preparedness, readiness, and response. Because if we tackle the different phase systematically, we have much greater chances to be better prepared for the response phase. The European countries have had, incredible experience with Klebsiella pneumoniae, multi-drug resistant, and we know that one measure doesn't fit all. So just to put in the context, it's about, first looking at your vulnerabilities and addressing those vulnerabilities. Thank you.
Thank you so much, Ana Paula. Really important and helpful, actually. Now I'd like to ask to Emilio, Emilio Hornsby, who is from the UK Rapid Response Team. Now there was one of the questions around recovery, and they're asking, how do you transition from response to recovery? Because here we're really talking about the preparedness, readiness, and response, but we're not speaking so much about recovery. So over to you on this one, Emilio.
Thank you, Dr. April. I think that's a really important point. So recovery from outbreaks is sometimes a neglected part of the response cycle, not just in infection prevention and control, but in many, many pillars. So recovery, just to really emphasize, is not a passive process. It does not just happen with no effort. So investments in recovery are really, really important. But recovery can be quite a politically contested area. Because the situation that existed before was obviously the one that preceded the outbreak. So for some people, recovery is returning to the status quo, so returning to the level before. But for many people and for different groups within a community, good recovery should mean something different and better. So actually working out what recovery is becomes quite complicated. At a macro national level, we often only measure something like returning to the GDP from before, economic recovery, or returning to the same life expectancy, some of these big numbers. But within that, we ignore some neglected groups, some inequalities that might not give us the full picture of whether recovery is happening in an equitable and positive way. So I think the thing that we need to consider is, when do we consider recovery? And for me, it has to be part of the response, embedded in the response. And everything we do during response, we should be thinking about that transition into the what after, the next steps. Anything we can do during response to strengthen systems for the future is an investment in recovery and also in future preparedness. So that time during response is really critical, because that's when there is funding and energy and focus on the issue at hand. Oftentimes in outbreaks, we see everyone works incredibly hard on the outbreak response, and then it is declared over and everyone is exhausted and they go back to their normal work and the funding just disappears, and actually the systems haven't been strengthened. But if some of that energy during response can be targeted on recovery, and there's some great examples from Uganda during the Sudan virus disease response where they were considering the recovery at the same time as responding. And those are really good lessons for us to take to other settings. Thank you. Over.
Thank you, Emilio, for that comprehensive response. I think it's really important. And as you say, depending on which cycle you look at, the one that's being used in this implementation manual focuses on preparedness, readiness, and response, but recovery is also part of that emergency phase. And unfortunately, sometimes the focus is more on the response, which is needed, of course, without thinking about the recovery. So it's a really good point you made around the importance of having that in your mind, even when you're responding. So thanks for that. I'm now going to ask Marie Clara. There's a couple of questions here which are really looking at operationalizing the framework and the implementation, especially in low resource settings. So this is a question that is an important question and it's often asked. So the question specifically here, so thank you for the question, is how will the framework support frontline facilities, especially in rural and low resource settings, to practically implement IPC standards? So very good question to you. Over to you, Marie Clara.
Yeah, this is an excellent question and not so easy to answer. So if other colleagues in the panel would like to complete, in the framework and toolkit, there is several steps, including assessment of needs and requirements. So as my understanding, the first step is really assessing the situation, what you have in the hands before anything. So this can be adapted for challenges. So most of the implementation manual, in fact, it was designed to be implemented by low and middle income countries that have challenges. So no country is perfect, but we know that low and middle income have more challenges. So what I would say is start by assessing what you have, assessing what are your priorities, and then go step by step. And starting, of course, to implementing a task force to define the works you need to do, because it's impossible to do everything alone. So I'm just touching very few points, and I would like to hand over to you, April, and colleagues to more answers.
Thanks. No, I think that's great, Marie Clara. I think the other thing I'm thinking about is, one of the key action steps is around, and you've alluded to that, is around the partner mapping. So in addition to prioritization and having the task force, the coordination, mapping who is already on the ground there can be very helpful, because that can help to mobilize some of the resources, if it is limited resources, but also in the context of the rural environment where it may not have so much access. So it's important to know who's already on the ground, because they probably will already have their systems in place. And they can then, move much easier than trying to bring in new partners to support. So just wanted to compliment with that. I'm now going to go over to Ebeth. Ebeth, you have quite a lot of questions. Congratulations on an excellent presentation, and I think really bringing, the practicality of the tools and the experience that you've had in that. So there is several here that I'd ask you to maybe look at later, but there was one in particular, and I'm trying to find it. Sorry for this, which was about the implementation. Oh, here it is. For the primary healthcare work in low resource settings, did you assess access for water, sanitation, and hygiene services? And then it's from our colleague Maggie Montgomery. So thank you for the question, Maggie. It's saying, for example, in Ethiopia, less than 30% of primary healthcare facilities have access to basic water. So linking up with the WASH partners and efforts and highlighting WASH gaps is important for addressing critical IPC gaps. So very happy for this point, and maybe Ebeth, over to you on this one.
Yes, thank you so much for your question. And yes, we did obviously talk with our WASH colleagues, and that was a part of the initial assessments and sort of assessments throughout the actual pilot. So making sure that we were doing our due diligence, and whatever healthcare facilities we were working in had some form of access to water within their services, as well as electricity and, basic built environment sort of infrastructures. That's not to say that there still weren't significant challenges, as we're all aware, right? But yes, it is very much a part of the overall epidemic-ready primary healthcare pilot, for sure.
Great. And there's another question for you, if you don't mind. Here it says, the PHC's readiness for pandemic preparedness and prevention is something to be given a significant attention? do you plan on such structures, and what kind of building structure for isolation and quarantine is planned? So that's also a challenging one. Over to you for this one, Ebeth.
Yes. So a couple things come to mind. So yes, I think we all agree that sort of primary healthcare is very significant in sort of future outbreak and pandemic planning writ large. In terms of, did we have specific designs or blueprints around what a holding space or an isolation space should look like? I mean, no, because we already have sort of those resources available from WHO and various different documents. What we did try to do is, given sort of whatever the built environment was at the primary healthcare center, what we did try to do is make sort of due diligence in recognizing where there were spaces that could be utilized for holding, how we could in advance, build in that unidirectional flow if we needed to. Having all of that sort of ready to go ahead of the actual emergency was really important, because when we were doing simulation exercises, the worst thing you can do is have sort of impromptu isolation, right? Where you're trying to figure things out in real time, or how do we modify this environment now and we just have someone sitting outside under the mango tree. So we did make sure that that was a part of the mentorship and the planning that went involved. That being said, I will say that we are currently working at Resolve to Save Lives to kind of come up with an epidemic-ready primary healthcare facility blueprint, of which we've taken care and done sort of due diligence in trying to make sure that we are putting in all of those pieces into sort of a model blueprint for publication that will come out in the future. Thank you.
Great, Ebeth. And I see there's actually quite a few questions here for you. Like, what are the facilities where this was implemented in Uganda, but other questions as well. So it'd be great if you could have a look at those. There is a few questions centering around kind of the community element of IPC. I think this is also an important point. And the question is, maybe I'm going to ask maybe Ana Paula. And then if Maria Clara or Amelia would like to come in on this one, of course, Ebeth, you as well. So it's saying, does the framework integrate community level prevention measures and public education into outbreak response plans? So it's about the framework and integrating the prevention elements in the community. And if it doesn't, maybe why not? And, what would be the suggestion? So Maria Clara, over to you.
Yeah, well, this is again an excellent and difficult questions, but definitely we needed to work in cooperation with the community and communication engagement team. And when we are developing the implementation plan, we needed to map partners in communication and developing a pre-organized plan for communication to engage the community. So this is something that we can plan ahead before the outbreaks. This is not something that we just wait until the outbreak occur, but we can have joint initiatives to approach the community. Over.
Thank you. Ana Paula, anything you'd like to add to this?
I answered this to, there was a similar question, and I just want to say the community is one of the greatest supporters of infection prevention and control, right? Where we find sometimes obstacles that people say, these people from infection control, they like to talk a lot, tell us to do, you have to do like this, but they are not doing themselves. But the community understands, because we are doing IPC and WASH together. Infection control without WASH doesn't exist, right? So this is what is very close to the heart of the community. And I think what is important is that in addition to what Professor Maria Clara answered, that is, have to do the mapping, prepare, you already know, the usual suspects, right? People that you can count, and people can maybe, be your advocate, right? To make sure, especially for certain outbreaks. And then I'm sure that Emilio has lots of, examples to talk about, that this interaction between IPC and the community. But just to say, we cannot underestimate their value. And the more we engage with them, and the more we are transparent, accepting the vulnerabilities, the limitations, and the gaps, and we are committed to address those things, this is where the transformation start happening, right? Because, if it's a community that is always exposed to, lack of water or lack of sanitary conditions, and there is no commitment for changing this, of course, that it becomes difficult to get them on board. And I guess over to you, Emilio, to share also your.
Thank you. Yeah, I totally concur that the involvement of the community is critical in implementing infection control. I think there may be some historical reason why IPC has focused more on health facilities. And if you look at the official WHO definition of infection prevention and control, it's still focused around protecting patients and health workers from healthcare acquired infections. So historically, a lot of the normative guidance and a lot of the expertise in infection prevention and control has been focused on health facilities and preventing healthcare acquired infections. But as we all know, the boundaries between communities and health facilities are porous, and they don't really exist because patients are members of communities and health workers are also members of communities. And we know that outbreaks don't stop or start at the border of health facilities. So rightfully, I think infection control now is working much more strongly in communities. And as Ana Paula says, it has to be done in conjunction with other pillars. We can't respond alone. So water, sanitation and hygiene expertise is absolutely critical, and also working alongside risk comms and community engagement, because we are working in a landscape which is more complex, and we have to work with different specialities to make sure that our skills in preventing infection are applied in the right way in all of these different settings. Thank you. Over.
Great. No, really comprehensive and important points. And as you say, no outbreak has ever been, how should we say, managed and been able to actually to stop it without the engagement of the community. So thank you for all of those points. I'm now going to turn over to Artem. There's a question here, and I was thinking who would have the most experience and be able to answer this. And I think actually you're much better than any of us with this. So the question is, in the current conflict scenario, so if you're in a setting of conflicts, what additional preparations would be required in addition to maybe what's already been presented in the toolkit? So Artem, over to you for any thoughts on this.
Yeah, thanks a lot for a question. It's for one hand very easy, for another very complicated. Frankly, we don't know what will be happened even today evening or tomorrow morning. But still, I think as deeper will be examination on place for facilities, the better outcomes will be. I mean, we also, after investigation of 2 outbreaks, we saw like very specific picture, and we found out some issues, and we decided to see more broader, and that's why we develop more highly detailed assessment for each facility. And now we're going to examine each region and big facilities more deeper to understand which gaps they have. But overall, if in general, I will say communication is the main gap. Yes, thanks.
Thank you, Artem. And maybe just to follow up on that, is saying in the context of crisis, of course, we have outbreak crisis and we can have other type of conflict crisis, but it says what strategies, or the question is, can be proposed to prevent the shortage of supplies, for example, such as PPE, such as disinfection, and any other essential IPC materials. So with your experience in your context, how do you try to prevent these shortages? Over.
It should be used in right cases, I should say. So we saw some situation that facilities have a lot of PPEs, but they not highly educated and know when they should use in which cases. And that's why, to my mind, here proper using of PPE and education for doctor, for nurses, because nurses are using PPE more than doctors, is highly oriented, and to my mind, very practical education, very practical trainings that are organized in our country by IPC departments inside in facilities on sites is really helpful for nurses and doctors to understand how it used in practical, because you can read a lot of you can read 100 orders and guidelines, and when you go to the patient, you doing all wrong. So practical training is the highest priority.
Great, thank you. That's really important about people understanding when they should use the different PPEs and the supplies so they don't misuse them. Does anyone else from the panel, anything you'd like to add to Artem's, to what he said? Yes, Anna Paula.
Yeah, I just want to add, I think it's a very recurrent question, right, for us about the IPC supplies, right? And we are more than personal protective equipment. The P in IPC is not for the PP, the protection, is prevention, right? So what I want to say is, in addition to implement rational use of IPC supplies and personal protective equipment and training, and I think it's also trying to make a forecast on the needs that you have. And then, imagine that, because we all remember, if this happens in 2020, it was not, 15 years ago. In 2020, we reached a moment that nobody had access, to masks, because some of the biggest supplier had a problem with with one of the substances that are used to produce, masks. So this happened, and we need to learn something out of this and welcome this transformation. So imagine alternative solutions. I'm sure that April, Maria Clara, and Emilio remember very well when we were developing the guidance for rational use of personal protective equipment in the context of shortage. That exercise took us out of our comfort zone. And I will put here the link of this interim guidance for those who haven't had the opportunity to read. That is the way that we have to, to force ourselves out of the comfort zone and imagine things that we wouldn't do it if equipment was not available. So that's what I want to add. Thank you.
Thank you, Anna Paula, and bringing back old memories. Okay, so I think we're almost close to the end. I did want to ask, I don't know if Dr. Abdi Mahmoud, if he's available, if he wanted to add anything, final comments or reflections before I hand back to Supriya. I don't know if Dr. Abdi is available. Just wanted to check.
I'm available. I'm online. I'm listening.
Wonderful. I just thought it would be really nice to hear from you if you have any final any comments or reflections, and then we'll go back to Supriya to close.
No, the last point about forecasting is just resonated with and brought back all those how that IPC doesn't end in one, and its continuation, as rightly mentioned. So working together with all the pillars, starting from the community all the way to the operation supply logistic team, and the forecast is key critical. But I'm really impressed with the turnout and the excellent and hard questions, but we had an excellent panel, well experienced. So I just want to thanks everybody again for a very enlightening and very informative session.
Thank you so much, and thank you for being available, even though you're on your leave. This shows Dr. Abdi's dedication, so thank you so much. And Supriya, over to you.
Very much, April. I'd like to start by thanking Dr. Abdi. I really appreciate your being here, especially on leave. I'd like to thank, of course, April for spearheading this and suggesting this. You know, we've had 900 people online at least. We've had, I think, about 60 questions and so many comments. So thank you all. Thanks to all the speakers, Maria Clara, Amy Elizabeth, Artem, Anna Paula, and Emilio, of course. And also in the background, Mahmoud, who's been answering questions. I hope I haven't left anyone out. I'd like to thank Kanika Sachdeva, who's been working very hard in the background, answering your questions on chat, sharing the presentations, coordinating everything. Huge thanks to Kanika from Project Echo. But as I said, I think the participants have been fantastic. So huge thanks to all of you for joining us, for asking your questions, for sharing your insights and being so engaged. You know, this is really, really appreciated. And I hope you will complete the survey. Many of you have asked about certificates. Now, because EPIWIN is a knowledge sharing platform, where we have exchange of knowledge, we don't automatically give certificates, but if you respond to our survey and request for a certificate there, we will give you a certificate. So just to clarify that. And finally, we'd like to hear from the participants what is important for you. So back to Slido, slido.com, hashtag 2990529. What key points from this webinar was most important to you? Because we at EPIWIN have webinars which we hope will be of practical use to all of you. And in fact, that's one of the survey questions as well. So we'd love to hear from you. There's only one response. There's still many of you online, so love to hear from more of you. Very quickly. Expert panel. Yes, we had a fantastic panel. I agree. Plan, preparedness, coordination. Case reports. So different parts of the presentation you heard from the country perspective, the regional perspective, overview of the framework, what works in PHCs, you know. So what was most important for you? Interesting. Case studies were the most important, along with preparedness, sharing knowledge. Great. So the Slido will be online for a while, so I will keep that so we get your full feedback if any of you want to keep sharing that. I'll stop sharing my screen for now. And with that, thank you all very, very much. And we hope to see you at the next EPIWIN, which will be in March, on the Wednesday, 11th March, and it will be on women in health emergencies. We look forward to seeing you there.
Thanks. Bye, everyone.
Bye.
Bye. Thank you. Bye.